Hi, my name is Bailey Lorenz and I am currently a student at Southwest Baptist University. And today I will be presenting on healthcare team bedside reporting. Why is this topic important to me? As a baccalaureate graduate, it is important to invest in the type and quality of care we provide our patients, not just provide care, and I feel this increase in bedside reporting will improve the care and understanding of care with our patients. Like I stated, as a baccalaureate graduate, I feel it's very important that we are involved in the research process in providing better patient-centered care as compared to a registered nurse who is providing that care to a patient. Why I feel this is important to the public. So the public is who we will be providing this care to. And as me being a part of the public, I feel improving the care within our healthcare system should always be considered a priority. Why is this important to the healthcare system? So improving care, like I stated for the public, improving care that is provided to our patients will increase the trust the public has in the healthcare system. So for example, you go to the hospital and you have a very non-patient-centered care experience. Plenty of times I've heard patients complain about, I went to such and such hospital and they just didn't care about me, they didn't listen to me. And I feel as baccalaureate graduate nurses, we need to invest in that type of problems. We need to invest our time in figuring out how to make patient care feel more centered around the patient. Although we are caring for them, sometimes we're seeing the problem more than we're seeing the patient. And so I feel why this is important to the healthcare system is because if we're improving patient satisfaction, we're going to have more trust built into the healthcare system, where patients before were switching hospitals and switching primary care physicians, now when they have trust in their healthcare system, they'll stick with a doctor, and a doctor will be able to follow that plan of care and then essentially keep improving patient satisfaction. So why is this important to the patients of review? So the patients I had in my study of review is just a typical patient on a med-surg floor of a hospital. And so typical med-surg floor patients are either getting med changes, or they're post-surgery, or they're doing cardiac monitoring. And I feel it's important that these patients are updated on their plan of care daily, if not a couple times a day, if not by the nurse, also with the physician. And so this topic is geared towards increasing patient satisfaction with the care being provided. So my end goal is to increase patient satisfaction, and how I feel we do that is by having the patient understand the plan of care we have planned for them. And so that's where I'm going to delve in with the rest of my presentation, is just to talk to you about the research I have conducted on physician and nurse, and actually the whole healthcare team bedside reporting. My PICO statement was, for an acute care unit, will implementing physician and nurse bedside reporting compared to no intervention increase patient satisfaction with treatment plan over a 3-month period? So how I picked this PICO statement is I felt just as a nurse in an emergency department, I noticed that we are very involved with our physician, and most of the time we're in the room with our physician while they're giving the plan of care to the patient. And so from coming out of nursing school and working on the floor, med-surg floor, I seen that these patients in the ER are being updated on their plan of care, if not hourly, because in the ER, we're trying to figure out if you need to stay or if you need to go home. And so I feel that it's just as important for the med-surg patients to understand their plan of care, because plenty of times as a student, I saw that a patient wasn't understanding why they were still here, or why that lab value might have been critically off, or they're just essentially their next step to getting better. And so I feel this is something that if we can implement on the floors, physician and nurse bedside reporting, this would increase patients' understanding, which would essentially increase patient satisfaction, which is the goal of our hospital not to just make them better, but for them to feel like they are a part of their care. Description of the search for the 5 articles. So I searched a couple databases, as in the CINAHL Complete and the ProQuest Nursing and Allied Health Science. And with these, I had some specific terms I'd use, and started out using acute care unit and physician with bedside reporting and patient satisfaction. And I found a whole bunch of results. So I went ahead and narrowed it down with the help of my professor, with a few critiques, that I should probably add nursing. And that brought my results down to 34, which really helped, because although I wasn't finding studies specific to physician bedside reporting, I was finding studies that was proving that nursing bedside reporting was increasing patient satisfaction. And so essentially, with there not being any research on physician bedside reporting, I found that it is just as beneficial to study how and why nursing bedside reporting was increasing patient satisfaction. And so a few of my limiters and expanders I used, because I wanted my topic to be pretty broad so I wanted full text. I wanted to be able to read the full study, and then also I wanted it to be hospital-based. Within the hospital. And so I didn't have an age limit. It could have been on a peds floor, geriatric, oncology, any of those floors. I just wanted to see bedside reporting and what it did for patient satisfaction. Discussion of summary findings. So the article I found, and really found a lot of my research and really guided me in if I were to actually conduct this study, I feel that this would be very beneficial, is patient-centered interprofessional collaborative care, factors associated with bedside interprofessionals. And so when I found this title, I was like, whoa, this is definitely going to be discussing bedside reporting. And so one thing I found really important while choosing my articles was understanding similarities they had, inconsistencies, limitations, and the gaps. And so through a couple projects we did through this course, I was able to determine these categories by reading through some articles. And so with the 5 articles I chose to study to conduct the research over physician bedside reporting, I found that all of these articles I chose were all in a hospital setting, which I told you earlier that I chose as one of my limiters and expanders. Similarities was that also they compared a couple of different units, all about the same size beds, and all around the same amount of patients. Some inconsistencies I found throughout all of them was that, being able to get patient feedback, which was my most important part of my study, because that was where my outcome came in, where I could draw results. And so I knew going into this that patient feedback would be a hard thing to gather. And so I feel throughout these articles that is something I would need to improve in my own research study. Some limitations they had was, again, the patient feedback. And so I feel like one article I read, they interviewed the patient before they left and let them know they'd be sending them a questionnaire with very specific but not very detailed questions just on how their stay was and what they were looking for, and if the patient was willing to help them out with this research study. And I felt that that would be the best way to try to yield the most results. The second article I want you to see that I looked over was the article that was titled Patient Satisfaction After Implementation of a Person-Centered Handover in Oncology and Patient Care, a Cross-Section Study. And so just in this title, I found the patient satisfaction that I was wanting. And so I kind of felt that this one was a good one to look into just by the wording of person-centered handover, the inpatient care, and patient satisfaction. And so when I looked into this article, as of the one like I just discussed, similarities were that it was an in-hospital, more of an acute care, short setting, not a nursing home or a residential home. It was a hospital setting where they were coming in for a very short amount of time. Also, it was a person-centered handover. So I felt in that title it meant when a report was being given, it was given in the room with patient being able to hear and even comment on a few things. And then some inconsistencies, the same was getting patient feedback as well as limitations. Also limitations was after the patient left, if they were too ill to actually comment back on the questionnaires. So in conclusion, explain to you why I feel that there is or is not evidence to support a practice change. And so right now, with the specific study that I would want to conduct and potentially change practice is the physician bedside reporting. And so not very many articles was specific to physician bedside reporting. But I feel as compared to the nursing bedside reporting, we are seeing a change in that, and we are seeing that it is beneficial to collaborate information in front of the patient and even have patient comments while giving the report. And so I feel that if more research, and after conducting hopefully the study and then more research being done, that physicians discussing their plan of care like they would with the nurse out at the nursing station, discussing that bedside would increase the patient's understanding. And I don't see how increasing patient understanding would not increase patient satisfaction, which would then increase why we would want to implement a practice change. I did not see a guideline, so there isn't any evidence to compare to. So that is why in my PICO statement I said no intervention to compare to, because the only other intervention would be no bedside reporting. And so I feel that bedside reporting is going to involve the patient. And I feel that is all a patient is wanting, is to be involved in their own care and to understand what the next step is into getting them better. Because any patient who enters a hospital, that is their goal, is they want to feel better. And so I feel involving them and asking them their opinion and getting them on the level they need to be to understand what's going on is very, very important and would be very beneficial in increasing patient satisfaction. And these are my references. Thank you.